Doctors of Reddit, what's the most incorrect patient self-diagnosis you've seen? Elderly man with dementia brought in for suspicion of toxic epidermal necrolysis, a serious and life-threatening reaction where your skin peels off in sheets. Nope. It was a very large burn because they left grandpa alone at the house and he spilled a teapot on himself and the family, and another hospital were too dumb to figure it out. This thread is like reverse WebMD. Think it's cancer? You just stubbed your toe. Think you have a cold? 100% cancer. Not a doctor, but a psych first responder. Patient self-diagnosed as dead. EMTs didn't believe him. He was quite insistent though, and wanted an ambulance ride because he thought a dead person ought to have one. The EMTs argued with him, stating that he was both standing and talking. He countered that he was in hell. In fact, he was just pretty high with a bad drug combination. I had a fun hour with him while he came down. Pediatrician here. A lot of parents come in thinking their child has cancer because they won't eat anything. Actually, they just don't like vegetables and are eating themselves to obesity with the crap you substituted with. Man who rode his bike as sole method of transportation came in for chronic knee and leg pain. He had metastatic prostate cancer with bone lesions all over. Came in for my legs hurt. Left with hospice referral. I would say after a couple years working in an emergency room before and during medical school that by far the most common egregious self-misdiagnoses involve pregnancy. Tons of sexually active patients coming in complaining of morning sickness and gaining weight, and just sure they have some sort of GI issue or infectious disease. When it comes around to asking questions, oh yeah, come to think about it, I haven't had my period in 3, 4, 5 months. That's not to mention the people coming in fully in labor and delivering in the ED. Truly shocked that they were pregnant at all. Now I understand people can have irregular periods and there are many cases where the patient is reasonable in not guessing what's going on. But there is a large group of patients who missed a lot of obvious hints. Denial ain't just a river in Egypt, I guess. And I do have empathy for patients in situations where they really don't want to be pregnant and so perhaps are subconsciously blocking it out of their mind. But a medical mystery it is not. As a paramedic I responded to a dispatch for a sick person. When we arrived this old guy was clearly having a stroke. He said I just ate some bad fish or something before taking a 3-hour nap. Luckily his wife finally decided to call 911. When I was 15 my mother was absolutely convinced that I had bono, as I was coming home from school and sleeping for several hours, eating dinner then going back to sleep. So, she took me to the doctor who did an evaluation. It turns out that I didn't have mono, I was just lazy. Side note, this period of laziness was only a few weeks after the conclusion of varsity swim season, so I was naturally exhausted from months of training. Not a doctor, but a doctor diagnosed my wife with a STD. Chlamydia maybe. Huge fight. Wife was emotionally crushed. She accused me of cheating. Ducked up. Punched her symptoms into WebMD and told her it was probably kidney stones. Turned out to be kidney stones. Edit. Words. I once thought I had a perforated colon because my poop was bright red. I spent an hour on the toilet in pain googling symptoms and then I remembered I got high the night before and crushed a bag of flaming hot Cheetos. Okay, so why do you think you have glaucoma? Well, back in 2002 I got shot right here, and it was a Glock. I'm not creative enough to make this it up. I'm not a doctor but I am a medical assistant. I did my preceptor at a kidney and hypertension center. Had a guy come in complaining of painful urination and thought he had a UT. Gave him a cup and told him to pee and set it in the window. The lab took the cup and immediately brought him back to a room. Which was strange, BC this place stayed packed and it was all first come first serve kind of thing. Well, this guy went back, BC there was blood in his urine. A lot of it. This guy was beyond 300 pounds BTW. Just massive and extremely tall. Doctors got him in the room and stayed for maybe 15 minutes before we had him transferred to the ER. Apparently, he had a fractured D and had no idea. The nurse above me said they lifted his gut and his entire groin was purple and black and his D was at a weird, swollen angle. She said she'd never forget it for the rest of her life. The guy never did tell us what happened or anything. He acted just as surprised as everyone else. TLDR, UT turned out to be a broken D. Not a doctor but is somewhat related. This one night I started getting some excruciating cramps that were so bad I had to wake my mom. She asks me where the pain was and I pointed out the right side of my stomach and instantly she tells me to get in the car and we go to the ER. She thought I had appendicitis. We get there. I'm hooked up to morphine and they get an x-ray. I didn't have appendicitis. I just had to it real bad. Late to this but my friend has an incredibly tough, alcoholic grandma. She ignored a stroke because she thought it was a hangover. Saw a patient last night who had been having episodes of wind for 6 months and had come in because of a particularly bad bout. Massive heart attack with crescendo angina over the preceding year. Not that uncommon a self-misdiagnosis but kind of takes you aback when you see it. I'm not a doctor but I am a medical professional at a hospital. Patient came in stating that he had blood in his stool for almost a year and was convinced that it was just because of hemorrhoids. He only came in when he started to get abdominal pains. Turned out to be colorectal cancer. Moral of the story is if you have blood in your stool, especially dark colored, don't ignore it. Not a doctor. I was the patient. Got incredibly drunk one night and decided to finish off the night with an amazing Taco Bell feast. Woke up the next morning with an incredibly bad stomach ache. This continued for about 3 days and I was constipated the whole time. My roommates, all pre-med or nursing, thought it was just the Taco Bell causing some issues but on about day 4 I couldn't take it anymore and had one of them drive me to the hospital. He continued to call me rich and said they are just going to tell me to take laxatives. While at the hospital they noticed my appendix was incredibly swollen and about to burst and was rushed into surgery. On my way to surgery a doctor came running and screaming to stop and he showed the x-ray to the surgeon and they decided it wasn't the appendix that was the problem but my intestine. Somehow my colon folded into itself like a sock and causes incredible swelling and build-up. Ended up going on antibiotics and morphine for a couple of days and got to miss all my exams. Other than anatomy, that D-head made me take a longer, more difficult, and extended response only exam. I have no idea how this happened and the doctors tried explaining the possibilities but I was too ducked up on morphine to understand. I remember them asking me if I recently went to Haiti or the DR. About 3 years later I started to have similar pain and went to the doctor immediately and this time they just took my appendix out. TLDR. Thought I was constipated from Taco Bell. Doctor said my appendix was about to burst. Then another doctor stopped me from going into surgery and said my intestines folded into each other. Mother brought in her 3rd child. Kid's listless, pale, muscle tone is poor. Mother claims kid has misses. So doing my checks asking about food and home environment. Mother tells, oh little kid is lactose intolerant so we only use almond milk. Run a panel. Not only is the poor little 2-year-old not lactose tolerant dumbass mother has been starving his poor brain of nutrients by feeding him only vegetables, but no protein or protein based items like legumes. Kid is developmental delayed because she saw an internet article on it. Ended up calling CPS on the edge. And having all of her 3 children removed. Had a daughter with bulimia. It was horrifying. Still pisses me off when I think it about. Physician assistant that works in the emergency department here. Had a woman, around 45 years old, come in with her mother for a complaint of a spider bite to her back. It was actually an abscess. No big deal. That's pretty common. People think abscesses are spider bites all the time. I incised and drained it and sent her home on antibiotics. Pretty standard procedure. Told her to come back in 2 days for a recheck. When she came back it was looking better. She and her mother thought it was something serious because it still wasn't all the way gone yet. But it was healing well and there wasn't much to do. She and her mother came back again another 2 days later and told me it was definitely gangrene. I tried to reassure them, but they both kept arguing with me that I didn't know what I was talking about. It was obviously a healing abscess and was looking a lot better. Looked nothing like gangrene, which they had googled. Had to get 2 of my colleagues to come in the room to reassure them but they still didn't believe us. Think they ended up going to another hospital. TLDR. Woman came to the ER 3 times for an abscess she thought was gangrene. Psychologist here. Saw leathery woman who drank 3 pots of coffee a day to cure her anxiety. Wish all problems were this easy to fix. I was rushed to the ER as a kid because I woke up and my face was blue. Obviously my parents thought I wasn't breathing. I'm 8 or 9 years old, and everyone's sudden change in demeanor is making me a little scared. And I'm just getting bluer at emerge. They're running all kinds of tests that aren't showing anything wrong with me. Until finally my dad realized that I put the brand new Toronto Maple Leafs pillowcase I just got on my pillow. Washcloth later, I was all better. Obligatory not a doctor, and it wasn't a self-diagnosis. My brother was acting really weird at my wedding, behaving like a jerk and his hands were shaking. He was my best man, so that made for some awkward interactions. He's also bipolar, so we all thought he was just off his meds. Combined with a lack of sleep, it was a 10 AM wedding, and he was working nights at the time. 2 months later he was diagnosed with a brain tumor. Not a doctor, but I went to the hospital about 5 weeks ago with what I thought was testicular torsion. I got told it was orchitis and was prescribed antibiotics for a week and was told it would feel better within days. Pain got worse and so did the swelling. Turns out it was testicular torsion and was operated on and sent home without my left testicle because a doctor was so certain it was just an infection and didn't feel it was necessary for me to have the appropriate scans to double check, which I'll later get told that it should have been the first thing he should have done in the first place. So now I'm 20 years old with a missing testicle and about a week now from full recovery. Duck you doctor, sing you incompetent wankstin. Edit. For those wondering or assuming, I'm from the UK, not the US, although suing does sound super American. He had some belly pain and thought he had a UT. Also had weight loss, night sweats and some other stuff. He had terminal pancreatic cancer and 2 weeks later he is delirious and at death's door. This story involves me, the idiot patient, my co-workers, the concerned family, the patient first doctor, who diagnosed it wrong, and the doctors, who got it right. So I'm at work and I have this pain on my right side. It's kinda just a stabbing weird pain when I breathe, and I can't take it, like something is blocking it. I go over to my co-worker and I'm sitting on her desk, rubbing it, and she says, "What's wrong, Fristisbox?" I mention that I haven't been able to poop and this pain, and another co-worker pops up and starts poking at my abdomen and says if it bounces back it's appendicitis and I need to go to the doctor. I'm like, dude, it's probably just gas. But office mom loses it and tells me I have to go get it checked out. So I go to patient first and they run my blood and feel my abdomen, and the doctor comes back very concerned. "Fristisbox, your white blood cell count is really high. I want you to go to the ER right now." So in my car I go to the ER. The ER people take me back and they run my blood and they're like, "Fristisbox, your count is super high. Let's get you some scans." So I've been here for 4 hours doing all these scans, waiting for it to come back, and everyone has been poking and prodding at me, and my side really ducking hurts and I'm thinking I'm going to have to go in for emergency surgery. Finally, a new doctor comes and is like, "Good news, we're releasing you." Okay, yeah, you don't have appendicitis. It's just a grapefruit-sized tumor on your ovary. Here's a referral. ... No bedside manner that dude had. I'm not a doctor, but when I went to see a physician a year back for my shaking problem, I have severely shaking hands. I was told that it was a short-term problem that would likely go away in my late 20s. I told him I was on medication, and he dismissed it as an unrelated issue. Recently, I went to a different doctor. He assessed my symptoms: jolting limbs, twitchy face, shaking hands, locking jaw, etc. Turns out I have tardive dyskinesia, which is a very rare side effect of one of the medications I was on. It is irreversible after age 25. If I had listened to the first doctor, I would have permanent brain damage as young as 25 years old. Edit. Fixed spelling. Schizophrenic guy thought his lungs were rotting, but it was okay because he just get a new torso from NASA. He's not even American. I don't know why NASA would give him said non-existent torso. No a doctor but a pharmacy technician. Had a patient yesterday tell me they went to urgent care and the nurse diagnosed pink eye. The patient didn't feel right about that and went to the eye doctor. Eye doctor told her she had an ulcer on her eye and if it went untreated properly she would lose eyesight and possibly the eye. I was actually the patient but had convinced myself I had ovarian cancer. At 25 it was highly unlikely. But since I'm on immunosuppressants that increase cancer risk and had hundreds of x-rays and CT scans, buttload of radiation, to my abdominal area, I was worried when I had all the symptoms. Turns out I was full of it. Literally. Found out ovarian cancer symptoms are nearly identical to constipation. Extra water and fiber supplements cleared that up. Don't trust WebMD. It makes you look like an idiot. However, when you live in a hospital for years and are taught to freak out over every little thing, liver transplant recipient, it's a hard habit to break. I personally knew a guy who was diagnosed with lung cancer in college at the age of 22. He was so young and lived a clean life, so it was confusing to everyone, even the doctors. They progressed very quickly with the treatment, and he was scheduled to start chemo. He was doing some sort of pre-diagnostic meeting, and an intern was involved. The intern started asking some very different questions, and he eventually asks the patient if he had been in Kansas recently. It turned out he had, in fact, spent the previous summer working in Kansas. This was a few weeks after. It turned out the intern had been writing a paper specifically about localized diseases, and there was this disease in Kansas that he had focused on. It had something to do with hay, but it wasn't hay fever. The intern was basically telling the doctor to humor him and run this one specific test. The doctor agrees, and the test comes back with results that show the intern was onto something. The patient went in for chemo treatments with a grim outlook, and he left with 10 pills he had to take over the next 5 days. 1 week later, he was completely fine. FWIW. This was in the year 2001. Not a self-diagnosis, but I had been seeing various doctors for months with what they thought was post-viral syndrome or depression depending on how the doctor felt that day. Then after being out in the sun one day I developed a malar rash and my husband decided it looked like something he had seen on a medical program called lupus. Doctors laughed me and him out of the consultation room for months. I was too young, not the right race, no family history etc. etc. Turns out they decided eventually to order the right blood tests and I have lupus. I do love doctors, but realize now that often their guess is as good as mine. I know a girl who woke up one morning and felt pain in her abdomen. She thought she had gallstones and phoned the ambulance. Wind? She had trapped wind. I thought people only made these kind of mistakes in cartoons. Uncle is retired nephrologist. Favorite story was the woman who came to him and said she had fireballs of the Eucharist which, correctly translated, were uterine fibroids.